at your initial physical therapy examination, we're going to first start by going over your intake paperwork. So we've read through your intake paperwork, and I've got some questions to ask you about some of the stuff, and I want to hear your version of what's going on, a little bit more detail. So now that we've gone through your intake paperwork and I kind of have a better understanding of what's going on, let's get on the same page with anatomy. So we're going to go over pelvic floor anatomy. We're going to go over talking about how this all works, and then we're going to see how you move. Okay, now I'm going to want to see the way you move. So can you show me a few squats? And can you turn and face that way and do a few? Good. Can you turn and face me again? Can you just stand on one leg? Good. Can you stand on the other leg? Good. Pretty good. Can you stand on one leg again and then give me a few little mini squats? Yeah. Keep going, keep going. Good. Let's see this side. Interesting. Okay, cool. Let me have you hop up here. I just want to look at how your hips are moving. Yeah, lay on your back for me. Sorry. Good. Let me just see your hips, hip motion. Cool. Ooh. Very bendy. All right, looking at her foot, comparing it to the other foot, ankles. Interesting.
We're learning so much.
Oh my, we are. Hello, Phoebe.
We're working on it.
Oh, okay. Depending on why you're here, we might also check out what's going on in your abdominal area and checking out diastasis. Great. Cool. Looking at SI joint if we need to look at SI joint, or looking at your low back if we need to look at your low back. All right. For an internal examination, you're going to be fully covered. We don't have stirrups or a speculum like an OBGYN. So I'm just going to have you bend your knee and kind of relax it onto my leg. And if you can bend this knee also and kind of relax it out to the side. And then we're going to demonstrate on the model what we do next. For a pelvic floor internal exam, we need to first start by touching the vulvar tissue and observing the vulvar tissue. We may spread a little bit to see the more inner area of the labia minora. Then we need to see how these muscles are run up under your pubic bone and across towards your sit bones. From the outside, we're just going to press on those muscles. It should just feel like pressure. It shouldn't feel uncomfortable or pokey or stabby or in any way. And then the same thing on the inside, right? We want to see how are these muscles doing with one finger inside. They kind of loop around and they horseshoe back. So we're going to feel towards the front. We're going to feel towards the back. We're going to feel a hip muscle up here. These muscles that connect from your ischial spine to your sacrum and to your coccyx. And we're going to feel the same things on the other side. Nothing should feel uncomfortable. It should all just feel like weird, deep pressure. Nothing should feel achy or stabby or sharp or scratchy because we have a gloved finger that is lubed. Anything beyond feeling pressure is abnormal. We may want to feel how those muscles are working depending on why you're here. So if those muscles are not able to contract when we ask them to contract and do a pelvic floor muscle contraction, or what we call a Kegel, we want to see how quick it is, how long you can hold it, and how expedient they are, and if you're able to coordinate relaxation with your pelvic floor. We may observe that externally on the outside by seeing how the outside of your pelvic floor is reacting. We may observe it on the inside. It just depends on the patient and what we're needing to look for that patient. So now that we did your initial pelvic floor examination, we need to talk about what we found and our plan to move you forward. So now we're going to talk about our findings, whether those were biomechanical or something else is going on. We need to basically say what we're gonna do in each follow-up treatment visit with you, and what I need you to work on at home when you're not here to help get you better as fast as possible.